continue introductions, starting with DFR staff. Go ahead.
Good morning. I am Karen Winkle, the rules coordinator for the division.
Thank you.
Hi there, this is Tim Hinkle. I'm an actuary at the division.
All right, now we'll go to the rest of the rack. Please introduce yourselves. Let's try and go alphabetically if we can, but no big deal if not.
Hi, good morning. I'll go AA. My name is Antoinette Watry, and I'm a RAC member and the Senior Public and Regulatory Affairs Specialist for Cambia Health. Also, we own the Plans Regions Blue Cross Blue Shield of Oregon and Bridge Span Health. I'm still kind of consuming my coffee, so sorry for the gaps in communication.
No
Nice
problem.
to be here.
Thank you.
I guess I'll go. Hi, my name is Bo Wrights. I'm a government affairs policy analyst with Providence Health Plan, and I am a RAC member.
Good morning, everybody. I'm Katie Button. I am the plan management analyst for the Oregon Health Insurance Marketplace. So I certify the plans we sell, and I also help design the silver cost sharing reduction plans and the standard gold plans.
I'm Heather Weaver, and I'm an individual product manager with Cambia. I work with Antoinette, so I'm just here to support her if any questions pop up. So.
Good morning. Almost said good afternoon. I guess a little wishful thinking on my part. Scott White, Director of Regulatory Affairs for Moda Health. And I also have Teresa Barney and Mei Wu in this meeting as well from Moda Health from our product team, just to provide support for me. So thank you. Happy to be here.
And I am Teresa Barney. I'm Manager of Market and Product Development for Moda Health. And I think May dropped off. So.
Okay, well, if she comes back, we'll know who she is now. And I believe Tasha has joined us as well.
Hi, Ethan and all. Tasha Sizemore, Life and Health Product Regulation Manager for the division.
All right, and thank you all for being here. I don't think I need to go into too much detail about what we're doing here. This is based on the 2027 actuarial value calculator from the feds. We have determined that both the bronze and silver plans are no longer in compliance. And as such, we need to modify benefits. Essentially, we need to reduce benefits to come into compliance. So we're going to go ahead and go through first the bronze, then the silver. And then after that, I did forget to put this in the agenda, but we'll briefly go over the statement of need and fiscal impact. And then I also know that one or two RAC members wanted to discuss naming conventions for the standard plan, so we can do that after the statement of need and fiscal impact. And then we'll go to public comment and wrap up. So we'll go ahead and jump into the first one, and I'm gonna go off camera so you can't see the smoke coming out of my ears trying to figure out what all this means. But essentially, we came up with two options for the standard plan or standard bronze plan. In both cases, like I said, we do have to reduce benefits. The first option, option one, we raised the deductible and the maximum out of pocket for the combined medical and drug from $9,200 to $10,200. So raising it $1,000 in both cases. We didn't have to change any other benefits on that option once we did that. With standard bronze option two, we raised those deductible and out of pocket by a lesser amount, but also addressed raising primary care visit, specialist visit, outpatient rehab and outpatient habilitation, cardiac rehabilitation, and acupuncture and chiropractic. So there are kind of two courses there. One is just raising deductible and maximum out of pocket. The other is raising those by a lesser amount and tweaking some of our other visits by a little bit. So this is where I will stop talking and open it up to the floor to see what people's thoughts are. As I always mention, I lied. I will talk a little bit longer. As we do every year, nothing here is considered a commitment by anyone on the RAC. I will leave about a week for public comment or for review from you, everyone on the RAC, to take it back to their product people, take it back and mull it over, and then send which options they think are best for both plans. That way you don't have to make a decision on the spot. But hopefully everyone's had a chance to take a look at these options. So now I'll go ahead and zip it and open it up to the floor for the standard bronze. What are people's thoughts?
I prefer option one because it doesn't increase cost sharing. And I know that that deductible jump is kind of big, but I'd be interested to know if carriers happen to know if many people hit the MUPA deductible. But my preference would be to keep cost sharing low so folks can continue to access benefits.
Thank you, Katie. Any of our carriers, that may not be information you have readily available, but maybe anecdotally.
Hi, this is Bo with Providence Health Plan. The feedback that I received is consistent with what Katie, you mentioned, and we found that the lack of changes in general cost sharing would be less disruptive to our enrollees.
Okay, thank you. How about Antoinette?
Yeah, hi. For some reason, the only one I saw was the silver one. Maybe we weren't looking at it closely, but I'll say that I do support Katie's recommendation as well as Bo from the Providence Health Plan. I think the less disruption, or I guess the less changes in cost share would be less disruptive for our members. So option one for the bronze will likely be our recommendation.
Okay.
But again,
yeah, you may, oh no, I was going to say you may have fallen victim to what I have also made you didn't click on the tab at the bottom that said bronze or silver. I've missed that many times.
Got it.
Yeah,
And obviously,
I've done that many times, so.
And it's
yeah,
my faux pas. So
no,
but
not
we
at all.
will definitely send you something in writing by email after my product folks look at it.
Yeah. All right. So anyone else have any thoughts on the standard bronze plan?
No, this is Teresa with Moda. Just agreement in that the less adjustment and changes, the better for the population to be able to understand and have, least impact.
Okay. Sounds good. All right. And I think we did have someone else join us. Beth Black, are you on?
Yeah, I'm here.
Great. Okay. Thank you. All right. So with that, we can go ahead and move to the silver if anyone doesn't have any other thoughts on the bronze. And once again, like I said, and Antoinette followed up, we'll go ahead and give it some time for people to take it back and mull everything over and then send an email with their thoughts down the line. All right, so for the silver, once again, we did have to reduce benefits. We were able to come up with 3 options this time. And without going into every little detail, option 1 raises the maximum out of pocket from $9,200 to $9,950. as well as raising some co-pays on primary care specialists and some prescription drugs, as well as a few other specialist visits. Option 2 raises the maximum out of pocket from $9,200 to $10,700, but leaves everything else untouched. And option 3 raises the deductible from $6,100 to $6,350, the maximum out of pocket from $9,200 to $10,000, and then also does bring our specialist visit up from 100 to 120. So to kind of summarize, option 1 has the most kind of changes to visits. Option 2 has just the maximum out of pocket, and option 3 is deductible, out of pocket, and specialist. So I will once again open the floor. Looks like Bo jumped on it. Let's go, Bo.
Yeah, just consistent with our line of thinking with the bronze options, we favor option 2 for silver.
Thank you. Antoinette.
Yeah, that one we were able to view, and I'd like to also confirm and support Bo or Providence, excuse me, recommendation. Option 2 is best, consistent with our thinking for the bronze plan as well.
Oh, thank you, Karen, for getting it up there. Great. Thank you, Antoinette. Anyone else have some thoughts on the silver?
This is Katie. I agree. That MOOP is high, but I suspect that people are enrolling in the silver plan for prescription coverage. And so to me, it's important to be able to keep that preferred brand cost lower so that folks can still have a savings there with the higher premiums that are on the silver plan.
Sure, makes sense. Right. Anyone else want to share any thoughts or just table them for an email at a later time? Oh, all right. Well, that is kind of the end of the actual benefit discussion on both of those. And like I said, oh, Beth, option 2, thank you. I'll go ahead and say if you want to submit, you know, the feedback here is great. If you want to submit written feedback, we can give until, let's say, a week from today. So that would be what, Tuesday, April 7th by close of business. If you can send any thoughts by then, that would be great. Next, we'll jump into the statement of need and fiscal impact. For those of you who've been part of our rulemakings, this is a pretty straightforward standard document. I don't believe we need to read every bit of it. We go through the need for the rules. We also highlight where the documents relied upon are available. One section that we do want to highlight is the statement identifying how adoption of rule will affect equity in the state. And what we put here, as well as in the past, is the proposed changes to the rules will impact Oregon insurance companies and consumers who buy health benefit plans in this state. It's unlikely to impact one group of people differently than others because consumers have the choice to purchase different health benefit plans. For their existing state and federal regs prohibit discrimination in the sale and utilization of health benefit plans. Does anyone have concern with what we have there? And again, feel free to submit comment on that part as well. All of this is, fair game. All right. And then we also have the fiscal and economic impact. And here we have that the rule does not contain new requirements. There would be a fiscal impact to consumers who purchase the standard plans. Oh, and I do see a typo. I have 2065, so that needs to be changed to 2026. So people who purchase a bronze and silver plan in 2026 and purchase the same plan in 27 will will likely see a decrease in certain benefits. but we don't know what that impact would be. Fiscal impact to insurers is likely a small increase in administrative costs. So yeah, does anyone have any thoughts on that one? Okay. Cost of compliance for small businesses. Based on the information we have available, the proposed rule would not have a fiscal or economic impact on state agencies, local government units, nor the public. The proposed rule apply to commercial payers only and require minimal administrative effort to comply with the requirements. Insurers would be required to adjust plan language. Because members of the public may or may not choose standard, bronze, or silver plan, we're unable to quantify any potential fiscal impact on individual members of the public. So does anyone have any thoughts there? All right. And then when the next part is about small businesses subject to the rule, and based on filings made to DFR, no health insurers meet the definition of small business because no health insurer is independently owned and operated. How were small businesses involved in the development? This actually, I need to tweak the decline to participate. That's carried over from last year, so I'll remove that. But members of organizations representing small businesses were invited to the Rulemaking Advisory Committee. Was a Rule Advisory Committee consulted? Yes. And does the membership represent the interests of persons and communities likely to be affected by the rule? We also said yes, as it represented those most likely affected: health insurers, producers, and consumers. We did invite members of consumer advocacy organizations. And we will follow up with everyone. I'll send an email with the options again and the public or the comment date of April 7th so that everyone knows how the meeting went. And as part of the rulemaking process, yeah. Okay, so does anyone have any thoughts on that? All right. Well, then I will open it up for public comment, and this is where, if anyone has anything they'd like to bring up, now's a good time.
So I'll go ahead. Yesterday I was talking with a carrier, and we were talking about the name of the standard plans, and it's very long. And when we were like originally coming up with the standard plans, the marketplace had some requests that either never made it over to DFR or for whatever reason were just not implemented. And so recognizing that changing the words in the actual text of the rule is harder than just changing exhibits, this may be a 2028 thing. But since we're moving to our state-based marketplace, we will have a different layout for plan names. And when folks see the list as a whole, all of the plan name can be included. But when folks are comparing plans, the names will be truncated. And so for most of the plans, it's not a problem, because on the non-standard plans, the carriers can choose however they want to name them. But on the standard plans, the naming convention requires the carrier name and then Oregon standard metal tier plan. And then the carriers put their, if they have different networks, they put the network at the end. And that gets really long. And so I would recommend that we first take off Oregon, because everyone knows that it's in Oregon. I would remove the word plan from the name, because the carriers don't include the word plan in their other plan names, and no one is confused that that's, a health insurance plan. And then when you look at it, you can see, in fact, Ethan, is it okay if I share my screen?
Yeah, absolutely. I will, unless I'm reading the rule wrong, I don't think we require Oregon. It just says, what I see is name of insurer, standard, and then they pick, bronze, silver, and then plan. So the only required are the name of the insurer, standard, bronze plan. So it'd be like, MODA standard bronze plan. I'm not sure the requirement that it says Oregon is on our end, because I mean, I couldn't strike that from the rule because it's not in the rule.
Okay, so that's really helpful because I don't know then where Oregon came from, but that at least would shorten it. But let me go ahead and share. So this window right here, let me make it big so you can see. So these are 3 plans. This is Illinois' anonymous browse with the Get Insured platform, which is what we'll use. So these 3 plans you can see, if you hover over the text, you can see the name of the plan, but it really shortens them. And so the logo for the carrier is right here. So I would recommend that we consider removing the requirement to include the carrier name because it's redundant. And so then if you use this Blue Cross plan, for example, it could just say whatever the plan network is. So I think maybe Precision is the network. So it would say Precision, Standard, Bronze, and then you can have the ability to see the whole plan name there at one time. So that would be helpful if we could consider some ways to do that. And again, recognizing that March 31st, 2026 is perhaps not the best time to bring up changes to the rule text. This would be fine if we waited for 2028. It's just something to consider as we're moving to our state-based marketplace. We have some flexibilities in places and we have some limitations in places. So just want to make sure that folks can actually see which plans are the standard plans easily and they're not getting confused. Thank you for your consideration.
Oh yeah, no, I appreciate the feedback. Antoinette, you have your hand up.
Yeah, I should say that Cambia supports the marketplace recommendation. I think currently for the non-standard plans, there is some flexibility in the names. I understand with the standard plans or not. But what we're seeing more is that, at least for the non-standard plans, the network name precedes its first rather than in the back. So it would be nice for the standard plans to be consistent in the naming conversion, naming scheme as with the non-standard plans, if the marketplace also supports that.
So that might be a question. Could we put the network at the beginning? And recognizing that this may be a conversation then that we should have it like IC or something if we don't need to actually change the text. Just since we're having this conversation today, figured we might as well bring it up here as the starting point, and then we can take it to other places if it makes more sense. But so the question is, could we put the network name at the beginning? And then it sounds like we don't need to have Oregon, so we could remove that. So then network name, carrier name, standard blank plan.
Anyone else have thoughts on the suggestion here?
Yeah, Ethan, this is Scott from Moda. So, I mean, when you showed the screen, Katie, from the Illinois example, if you're going to start with network name and you're removing kind of pieces of logos or duplicative information on carrier name, I mean, a carrier name first seems, from a consumer standpoint, what you would want to see. Because a network doesn't, from a consumer standpoint, doesn't mean much to them at the shopping experience. That's just my initial thought, that the carrier name being first makes more sense, but I'll talk with our product teams. Again, this is just kind of the first time hearing of it, so happy to provide comments or discuss in other meetings. That's just my initial thought.
Thank you, Scott.
And I'll just note, we have quite a variety of the way that the carriers name their plans. And so again, IC might be a great place to bring this up where everyone has a chance to think about it. And then we can kind of, talk about if carriers who include their carrier name in their plans find that works better, if carriers who don't find that works better. So thank you. Thanks all for your thoughts today. This was helpful.
Teresa, you have your hand up.
Katie, are you suggesting that OHIM, as through the transition, is going to tell us their preferred naming conventions?
We're just trying to think of ways that might help the plans display better. And so I generally leave it alone and let carriers do what they want. The standard plans have a specific naming convention that kind of limits us in how we can display things. And so just wondering if folks want to change that, seeing what our flexibility is there, and then letting, and then allowing flexibility. So like if you like having your network name at the end and we can let people put it at the beginning or the end, that's totally fine. I'm not necessarily looking to I do think it's important to have a standardized naming convention in that it should say standard plan. You should be able to easily see what the standard plans are. But I think if, for example, Regents has the legacy network, I think if they wanted to say legacy standard silver and then MODA wanted to say MODA standard silver, I think that those are fine. So I'm just really information gathering, trying to figure out how much flexibility we have if we need to wait until 2028, again, having folks here, it came up yesterday. And so I thought that this might be a good place to just kick off the conversation, but I'm not looking to force carriers to do things that they don't want to do.
Okay, thank you.
Well, and just to clarify, the current rule naming convention is in brackets, it's name of insurer, then standard, and then brackets again, you have bronze, HSA, silver, and then plan. So right now, just the other thing is that the name of the insurer may be shortened to an easily identifiable acronym that's commonly used by the insurer in consumer-facing publications. So like I said, for example, I'll pick on MODA. It would just be MODA standard bronze plan. So again, no dog in the fight, just throwing out that that's the existing language in the rule. So yeah, I'm not sure where the requirement that Oregon be listed in there, other than maybe that was a remnant of old marketing or something, but yeah, I mean, we can definitely take that part out, save everyone at least that much. All right, anyone have any other thoughts on the naming convention? And again, feel free to follow up in email. Sometimes it's good to mull this stuff over.
Is it okay if I submit the naming question for the next IC topic?
Sure, works for me.
I'll do that. Thank you. And thanks all for your thoughts and feedback. It's really helpful.
Yeah, thank you for bringing it forward. It's always good to make the meeting a little more interesting than going through just a bunch of data. All right, well, we have hit the end of the agenda. Next steps will be, like I said, after this meeting, I'm going to send a follow-up email that will kind of include what I need from everyone. It'll give us the Tuesday by close of business for feedback and what we've discussed today. And then we'll wait to hear back from that. And it sounds like so far it's pretty safe to say we have a pretty good consensus that I can present to the commissioner. And after we get that formalized, we'll go forward and let everyone know where we've landed. And we will continue down the road. So if anyone doesn't have anything else at this point, we'll go ahead and give you some time back in your day. Thank you,
Thanks,
everyone.
Ethan.
Thank you, Rita.
Bye.
Thank you.
Thank you.
Thank you.